Welcome back to MLT 120 again. Today we're going to talk about the osmotic fragility test a little bit more in detail. Do you guys remember which anemia that we talked about earlier on in the semester that used the osmotic fragility test? It was hereditary spherocytosis. So what is the principle of the osmotic fragility test? It's to determine the resistance of the red blood cells to hemolysis when the red blood cells are placed in varying concentrations of a hypotonic saline solution. Remember, hypotonic is the lower concentration of a solution than is inside the blood cells themselves. So the water is going to be traveling inside the cell to help try to equalize the concentration. And when water travels inside the cell, guess what? The cells are going to swell up to the point where they could lyse. The specimen for this test is going to be heparinized blood. So we're going to collect in a green top tube. And when we say collect without trauma, we don't want our red blood cells already lysed. So we don't want a hemolyzed sample when we're going to be running the osmotic fragility test. Specimens are stable for 2 hours at room temperature or 6 hours if the specimen is refrigerated. As far as the procedure for the osmotic fragility test, we're going to prepare different dilutions of blood and saline to test our patient sample. So let's look over here. This dilution is a 1%. This one is a 0.85. This is a 0.66. This is a 0.58, I believe. This is a 0.38, and this is a 0%. So these are different concentrations of saline. And then we're going to add our patient sample to each tube. Then we're going to incubate the sample, and we're going to centrifuge and observe for hemolysis. Okay, so we're going to look and see and try to determine at what point the red blood cells lysed or burst and release their contents. Okay, this sample up here, this blood sample for this line on the top, is of a normal patient. Okay, so you can see hemolysis begins in the 0.66% tube because you can see a slight bit of pink. Okay, the red blood cells have released their contents. Remember, all these are spun down, so if there's any whole red blood cells, they're at the bottom. But if there's this pinkish tinge, the contents of the red blood cells are out in the saline solution. Okay, so this is a normal example. But this sample down here is of a patient with greater osmotic fragility. The cells lysed sooner. The cells started lysing over at 0.85% saline. Okay, you can see the pink started earlier on than did in the normal patient. Okay, so they have greater osmotic fragility, or their red blood cell membranes are more fragile. So the red blood cells basically just lyse more readily than in the normal patient. Okay, so prepare your solutions, add your blood sample from your patient, incubate, centrifuge, then observe for hemolysis. If the hemolysis starts earlier on in the solution than expected, then you have greater osmotic fragility in a patient. So for normal patient values for osmotic fragility, we've already looked at an example of a normal patient versus an abnormal patient. But a normal patient, the hemolysis should begin somewhere around 0.5% and end around 0.2% as far as your saline solutions. If a patient has spherocytes, and remember our spherocytes are small or macrocytic red blood cells. They're usually darker in color, hypochromic. You will see an increase in osmotic fragility. Their red blood cell membranes are just more fragile, so they're going to lyse more readily. patients with sickle cells will have a decreased osmotic fragility. Okay, those are just a couple things to note. I just wanted to show this normal patient versus the abnormal patient again really quick, just to make sure that we're clear on our solutions. On this left-hand side, there's more salt, or a higher concentration of salt on this side, and then there's a lower concentration of salt on this side. There's actually 0% in these two tubes, so this would be just probably distilled water. So the red blood cells in this tube for the normal patient, what do you think these red blood cells look like? Do you think they're taking on any water? Probably not, because they're at that magic 0.85%. So they're isotonic. They're happy little biconcave dish shape. So they're not taking any water on. They're not swelling. So you don't see any lysis or hemolysis in this tube. But this tube is where the red blood cells have started to take on water, and some of them have took on so much water that they've actually lysed, and you have hemolysis in this tube. And down here, because the patient's red blood cells are more fragile, they cannot even handle the normal isotonic solution because the red blood cells are more fragile. So they're going to even last at the 0.85%, which is normally the happy isotonic solution for our red blood cells. But in this tube, there's something wrong with the red blood cells. The membranes are more fragile. So this patient, again, has the increased osmotic fragility. So here's just a question. Why do spirochetes have increased osmotic fragility? But it's because the spirochetes have a decreased surface area to volume ratio, so they just lyse easier. Here's just another question. If we have a patient, Daffy, that has an osmotic fragility test done, and lysis begins at 0.7%, how are we going to interpret that? Pause the slide at this time and see if you can interpret before you go on to the next slide to get the answer. The answer is, if it starts to lyse at 0.7, it would mean that the cell is more fragile and they're going to lyse more easily. So this patient would have an increased osmotic fragility. Our next question, or our next case, is a patient Bugs has a osmotic fragility test done, and lysis begins at 0.3%. How would you interpret that? Pause the video or the slide and try to answer it on your own before you go on and get the answer. The answer would be, if patient Bugs starts to lyse at 0.3, it would mean that the cells are less fragile. So they're not going to lyse as easily. So you're going to have a normal patient for osmotic fragility. This concludes our lecture on osmotic fragility testing. I hope this gives you a better understanding of osmotic fragility. And if you have any questions or need any clarification, don't hesitate to reach out.